In many villages, especially Uganda, mental illness goes untreated and misunderstood and hidden. But some communities in Tororo are learning the truth that mental illness is real, recovery is possible. So in this video, I'm bringing you some of the things that we are doing on the ground in our communities, where we are teaching people about mental illness and different activities. So in today's video, I happen to visit Kwapa HC III, but before that I had gone to Osukuru HC III. These are found in Tororo District, and in my previous video I told you that Tororo District is found in eastern Uganda. It is a border district which is nearing Kenya. So from Tororo you can enter Kenya through Malava border, or you can use Busia border. Just being a border district, there are a lot of things that goes around. We have a lot of substance abuse, we have a lot of things like smuggling ongoing, we have a lot of young men and women using these substances, and within the district itself there is a lot of alcohol and substance abuse. So I began my journey at Osukuru HC III, and I met different health workers and taught them about mental illnesses, the services that I'm offering at Dr. Bale Medical Clinic. And the reason why we are targeting health workers is that these are primary health workers. They are the first people to get in contact with people with mental illness. So our aim is to equip them with knowledge so that they can be able to know how to identify people with mental illness, and also refer them to places where they can receive support. They can refer them to me at Dr. Bale Medical Clinic, or they can refer them to other facilities which are government, which are offering these services. So I had a good interaction with them, with over 60 staffs, and at their different departments, the OPD department, the maternity department. Maternity is also another department where we receive mental cases. We have mothers who are delivering, those who have, for example, epilepsy. The midwives need to be equipped with that knowledge to know that this mother has this condition, and in case of delivering, these are some of the risks that this mother may go through. Sometimes the mothers who are producing for the first time, they may have psychosis, and they feel like killing their babies, they feel like not breastfeeding, they become violent, so they need this knowledge. So when we go to them, we equip them with this knowledge. They have the message, they have the knowledge, or the basics of how to support them, and also where to refer this mother. So after that, my journey, I was called to the clinic to go and see some of our clients who have been referred to the clinic because of our previous activity in Bison A. I got 2 clients, some people who had information about what we are doing in community, because they had 2 clients who had mental illness, so they had to refer those people to me, and I had to rush there to go and assess them and give them the treatment. After that, I had to get my transport or the border to take me to Kwapa HC III. This one also found in Tororo District, and it is somehow a distant from the main hospital. It is somehow you pass through the Maram roads to reach there, but I was able to meet a good number of staffs, over 16 staffs who were still on duty. I reached there at around 1 p.m. So 1 p.m. most of the people have gone for lunch, but I was able to interact with them. That number, a good number of 15 people, and I had to share with them about the causes of mental illness. I had to teach them about mental health and the private services that we are offering at the clinic in Tororo town. But one of the the mental illness that is affecting people in Kwapa is substance abuse, alcohol and substance abuse. So I was able to teach the health workers so that they can also get this knowledge and also teach to the patients. Most of the people or the community members here believe that alcohol abuse is not an illness, it is not sickness. But I have to show the health workers that it is a problem. Starting alcohol is easy, but stopping needs you to seek an expert who can help that individual to overcome addiction. So I had to teach about substance abuse. I had to talk about epilepsy. In most of our clinics, in mental health clinics here in Uganda, who attend OPD or outpatient department, 60% of these people have epilepsy. Epilepsy is a medical condition, but because of some of the features, like some of these patients can get psychotic features like talking uncoded, seeing things that people cannot see, they have put them under mental health. And some of the health workers, the general health workers, are biased about handling mental cases. So these people are better handled in a mental health clinic, and I was able also to share with them about them. Then I had to interact with the in charge of the facility, and also plan to organize health education talk with the patients. The place looks nice, and I also had to go to the art clinic. That is where we are managing people with HIV, stroke, AIDS, people with TB. These are chronic illnesses, and some of these people develop mental illness because of taking drugs for long, and others, when they stop taking their medication, they can develop mental illness like psychosis. They start talking uncoded things. They start wanting to kill themselves. So I had to share the knowledge and create awareness about the services that we are offering, and also left there my contact with the health worker, so that in case they have a patient who is maybe challenging them, they can still call me for guidance. They can call me for consultation to see how best we can manage that client. Then from there, I had to leave some posters with mental health messages, some posters with the service that we are offering. Then within that week, my next activity was supposed to be community mental health awareness in Bison, that is Juba. So we had to organize. We do it every Friday, and this one is Bison C. Sometimes it is called Juba. So we had to reach there, and we were able to see over 16 community members. We got some challenges there that our mobilizers did not mobilize for us, the clients, as we requested them, but because we had already traveled there, we had to mobilize the clients by ourselves, and we had to talk to them about mental illness. Also in this area, there is a lot of substance abuse. Many people are drinking. You know, when someone drinks alcohol for a long period of time, some of them, if they are young, you find them looking older than their age. So there are many people with a lot of issues, kidney problems. There are people with a lot of medical conditions. So we had to share with them some knowledge about mental illnesses, the causes, the complications, how we can prevent mental illness, and those people who were able to listen to the message, they were so happy about the message. Then we had to exchange the contacts, and we gave them, some of them, the posters where they can, which have our services that we are offering, and how they can contact us in case they have emergencies in the communities. So our mission continues, but the challenges that we had also, it is a rainy season, so it rained heavily, so they had to cut us short. We had to get shelter from within there, and our mission was a success. We have some beneficiaries, some clients also identified from there who benefited from our services. And our mission is to continue covering the whole of the district with the mental health messages, but we are first of all moving within the municipality. It is so big, and I am the only mental health expert or psychiatric clinical officer who is on this team, who is leading the team to carry out these activities. But we are partnering, or I'm partnering with Heart for Families International and Dr. Bale as we mobilize for patients, as we mobilize for community members to teach them about different medical and also mental illness. So it is not an easy activity because Tororo District is large, and of the current news here it is being given a city status, but we don't have any private facility or anyone offering mental health services. So most of these people have to access the services in Bale, which always takes a lot of money to reach there. So in case people are having these people in the community, they manage them their own way by running to each doctors, and according to the research says 70% of people with mental illness they first have to run to the pastors, to the religious leaders. So our mission is very big because we are targeting different stakeholders. We are targeting churches, we are targeting the police, we are targeting the VHTs, we are targeting the local councils, we are targeting health workers. We have not reached those remote areas, but we are just within the municipality, but we feel overwhelmed, and due to the fact that we are not having those resources, we are ourselves trying to get some money, collect here 10,000, get fuel, collect this. It is a hard job, because even people who are mobilizing, they are supposed to, we are paying them. Okay, we are supposed to pay them and give them the money so that they can mobilize for us, the community members. And also we are in a political season whereby people are expecting, like in Uganda, people give out some money to people so that when they are coming to campaign. So we are doing this thing in the political season where people are expecting. So you find that sometimes the people may not turn up because they are not expecting to get money. So it is one of the challenges, but we have limited funding. We don't have donors, we don't have funders for these activities. We are doing it as a voluntary thing, but it has a lot of impact. We have seen people getting hope, those who had lost hope. We are seeing families, those who are stressed. You know, when you have a mental health patient in that family, it will be stigmatized, and even those people who are taking care of them, they are having a lot of stress. So we are counseling them, we are trying to educate them about how best they can manage people with these conditions, and we are seeing people recovering. We are seeing people who are now regaining their functionality in their communities. So if you are out there, yeah, you can still support us, support these activities. Mental illness is always ignored, but these community activities have really a great impact, and majority of our communities are neglected. They don't know where to receive these services. So we are continuing moving where we can reach, and we would appreciate for any kind of support that can be given to us, even equipment that can be able to cover what we are doing. It is also important, like camera, all those other things, so that our work can be recognized. And we continue moving to cover the municipality. So our next mission is Bison B. It also has a lot of mixed up people. They have a lot of people, they are highly and densely populated. That is our next destination. So thank you so much for watching. If you are still new to this channel, please subscribe. And my name is Enoch Francis. I am a psychiatric clinical officer, or you can call me the mental health expert, and I manage people with different mental illness. So please like, comment, and share with your social network, because this motivates me to make more of these videos. Thank you so much for listening. See you in my next video.